Many of you will recognise Jason McCarthy. He was an AFL footballer injured in the 2002 Bali bombings. He suffered horrific injuries, burns to 60% of his body. An injury like this, 2 or 3 decades before, would have almost certainly led to his death. But since that time we've improved the way that we can treat burns, so now people regularly survive an injury like this. But there's another problem, a problem that occurs in the months to years following the burn that we don't have a good treatment for. This problem is excessive scarring, and it can make burn survivors' lives a living hell. Excessive scarring is brought about when the body's healing process goes into overdrive, producing more and more scar tissue that isn't required. It occurs in 70% of deep burns, and this number is even greater in children, meaning that millions around the world are affected by it. It's terribly disfiguring. But on top of that, scar tissue isn't like normal skin at all. It's painful and tight, and over time it contracts. So that living with excessive scarring is like being trapped inside a suit of armour that gets tighter and tighter as time goes on, preventing you from growing and preventing you from moving normally. So during my time as a surgical trainee in the burns unit, I became aware of how excessive scarring affected the quality of life of burn survivors. And I wanted to use my PhD to see whether I could come up with a treatment to prevent this from happening. The first step was to take scars from burn survivors and analyse these for a certain protein called protein F. What I found was that protein F was significantly increased in these scars compared to normal skin. And this suggested that perhaps it was playing a role in the process that led to the excessive scarring. And if this were the case, we could design a treatment to block the action of this protein F and stop the vicious cycle of scar production that leads to the excessive scarring. So I was able to do this and then make the treatment so it could be applied as a dressing or a cream. I then tried this in an animal model of scarring, and I was very excited to see that in fact it did prevent the excessive scarring from developing. So the next step is to take this treatment and try it out in human patients and see if it exerts the same effect. If it does, it will be the first medical treatment in the world to prevent excessive scarring. And it will be a large step towards allowing burn survivors to avoid having to don this suit of armour and instead step back into their normal skin.